everyone. Welcome to our seminars on the analysis of official Canada data related to COVID-19 vaccine efficacy and safety. And I will start sharing my screen right away. And again, my name is Dmitry Gaidovich. I'm a data scientist with over 25 years of experience in data science. So this is your opportunity to ask as many questions as you wish related to official Government of Canada data related to vaccines. I know that vaccines or COVID vaccines specifically have become a very debated or polarized topic in our society, and we hope data can help different populations within our country to talk about this subject, because data, again, is just data. It doesn't support conservatives or liberals. It doesn't support truckers versus non-truckers. It just data, and it sometimes supports one, sometimes it supports the other group. And the best way to see when it supports in which group is by visualizing this data, because data also changes over time. And this is very important to appreciate. We live in our life in general. Nothing is stable, nothing is static. Things are changing over time. And this relates to vaccine efficacy, vaccine safety, it relates to deaths. And yes, there are many ways to look at this data. And here we show you the tools which would allow you to see the data better. It's the same data which is published by official Government of Canada websites. We just take this data and we visualize it. So today specifically, we'll be talking about the excess deaths. But before talking about that, let me remind you where you would find all the information about the analysis which we conduct. It's shown on your screen right now. We have a web page dedicated to the data seminar or webinar. We have it every Friday at noon Ottawa time. And anyone can join and ask questions via chat or later offline on YouTube, because we post all these recordings on YouTube. And we would every Friday would discuss a particular topic which is of interest to many of us. So this week we're talking about excess deaths, specifically in the year 2021. And we will also provide a little update on cases following vaccination. That's what we always do in the beginning of our seminars. So let's jump right into the latest update. For this, we go to the main dashboard, which is shown on your screen. And I suggest we just scroll down to the very bottom of the screen, which shows the table. This table is nothing but numbers which have been pasted from the official Government of Canada website related to cases following vaccination. And when we look in this blue portion, these are the numbers which are copied directly from the source, as you will see, from the source, which is pasted right here. You can go yourself there, or you could just look at the numbers pasted here. What do we see here? We see that the numbers are going up, again, up and up, again by about 0.8% since last week. The percentage of deaths among fully vaccinated has increased, right? So, and we have graphs which plot exactly the same information, but using just more convenient data science tools. So these graphs show you exactly the percentage of fully vaccinated among cases, infection, hospitalization, and deaths. So what do we see here? The last reported day was the 10th of April. And you could hover with your mouse here and it shows you the exact numbers here, as reported by Public Health Agency of Canada. And we see that indeed the blue bar, which is infection, have increased from 45.9 to 46.6, counting cases since December 2020. Now, we take this data and then we compute number of cases in the past week, and then we compute the percentage of fully vaccinated among those cases in the past week. And this is shown right here. So what do we see here? We see number of deaths, 75%. This again is percentage of fully vaccinated among deaths, as opposed to smaller number, which was 70% last week. So we see the dynamics is shown you right here on the screen. So these are very convenient two graphs which allow you to easily visualize the data which are plotted by Public Health Agency of Canada website. And again, the website is right here. It's this link which is shown right here. It's epidemiology summary COVID-19 cases. You can go there and it's table number 2. And we just plot this number. So that was quick update on the cases following vaccination. Today, our main subject is excess deaths. And you would see that on our main dashboard, which is right here on the portal ivim.ca, we have added this new graph, a new block dedicated to excess deaths. And what it shows you by province, the number of deaths per week, in particular for the age group from 0 to 44 years of age. And again, as always, we take official data. In this case, it's from Stats Canada, Statistics Canada website. And you can click on this link and it will lead you to this website, which is showing you right here, which is called Provisional Weekly Death Counts by Selected Group Causes of Death. And you would see this website provides you options to download the data. You can click on download button and you can download this CSV file. CSV stands for comma separated value. It's just a file which contains lots of numbers. And we download this file and we simply plot it using a nice data graphics package, which allows us to plot the total number of deaths by week for each province. So let's have a look what we are seeing here. We see that in Alberta, the red line, which is the number of deaths per week since 2020, is going slightly up. Again, just look at the horizontal line. It shows you the dates starting from the January 2020. That is the beginning of pandemic. You see that indeed since the beginning of pandemic, we have excess deaths, about maybe 10-15 deaths per week in Alberta, right? Then we started vaccination, and the gray line here shows you 1st January 2021. And you see we still have excess deaths here. Now the thick gray line shows you when the vaccination has been extended to general population. You remember in the beginning, it was only a high-risk population who was vaccinated. And then in about the 1st of April, which is what is shown by this thick line, we have vaccination extended to the entire population, to otherwise healthy Canadians. And that's what we are looking here. What happened after the vaccination has started with general public? We would, of course, hope that vaccination would help to reduce the total number of deaths. That's the key objective of any procedure or any measure which is undertaken in any country, to do something, whether it's quarantine, whether it's lockdown, whether it's vaccination, to do something which would reduce the mortality rate, right? And everything the government is doing is really trying to help to reduce the mortality rate. Because yes, we see the mortality has increased in Alberta, in British Columbia, in Canada, national, in Manitoba. You see it was higher than normal. So what is normal here? In this plot, blue line is the average 2 years average before pandemic. So this is 2018-2019 average data for each province, total deaths. Now, what is interesting that in New Brunswick, you don't see much excess death during the pandemic. But you, again, you still see in Newfoundland, in Nova Scotia, in Ontario, right? And Quebec and Saskatchewan. Yeah. Now, okay, we had excess deaths, more people are dying than normal during the pandemic. The government, each province has their own measures, own policies, and you know that policies in Alberta, for example, are very different from Quebec right now, or Ontario. And in Saskatchewan, for example, they are no longer even measure cases, COVID cases, from what I understand. So we have different policies in different provinces. And also we have potentially different vaccines administered in different policies, or sorry, in different provinces. So, and maybe not only type of vaccine, maybe different batches, different lots of vaccine. And recently there was a news that Moderna recalled one of their batches because it was contaminated, for example. I put it on my Twitter here, that indeed it happens sometimes. It happens in food industry, some food is contaminated and there are recalls because people are getting sick and poisoning from food infections, right? And the same happens, of course, in any industry. And I guess in vaccination is not exception. Vaccination is not exception from this situation. And this potentially could explain why we have such differences, why we observe such differences in the excess deaths in different provinces. Because here we do see huge difference between Atlantic, in particular New Brunswick, and let's say Quebec. Let's start from Quebec. You see in Quebec, young people or under 44 years of age, they have less mortality rate after vaccination than before vaccination. This is excellent news for Quebec, assuming, of course, that the data is recorded properly and we trust this data, which we do. I believe the data is the best source of trusted data, which this data published by Government of Canada agency is the most trusted, unbiased piece of information, which all of us, regardless of our political or religious beliefs, can rely on. So that's what we see in Quebec. Now, what is happening in New Brunswick? Here, definitely something started happening right after the vaccination. Again, we don't know what. This could be related to some other health issues. Maybe there was another pandemic there. Maybe there is poisoning there. Maybe there is a wave of suicides there. We don't know. What we see only that the death rate has increased from about 5 deaths per week in historical average to 10, then 15, then 20, now to 25. Now this drop here, just ignore it. It needs to be ignored because they many provinces, they just put zeros when they don't have data. When they have no data yet, they put zeros, and that's why it shows as if there are 0 deaths here, and there is a steep decline because we take the average of 3 weeks just to smooth the data. We take the average, the running average of 3 weeks. So just ignore the data where you see the curve goes down. So what do we see here is really we see going up, and in fact, if we put a trend line really we would like to see what is happening then. Is it going to continue going up? Hopefully not. I hope it will go down. But let's see what happens in other provinces. So you see, in Alberta also, it started to go up after general public vaccination. The same in British Columbia. It started going up after general public population. Manitoba stopped reporting deaths altogether since about June last year, so we just can ignore it. Now, Newfoundland also increased by more than 100% in excess deaths after vaccination. Nova Scotia not as much, but still some. Ontario also, you see that excess deaths after vaccination is more than excess deaths before vaccination, even during the highest peaks or waves of pandemic. Now, we don't know what is causing these deaths. What we do know is that currently Canada, as the entire globe, is experiencing the wave of Omicron variant. And there are many sources right now. My favorite is John Campbell from United Kingdom, who every day provides some insights from official data. It's very important that he's like myself using only official data here, which shows that Omicron right now is 99% of all cases is Omicron. And it's apparently, or not apparently, based on the data, it's a very safe variant, meaning that most people who have it, majority, like 99.9%, don't have complications from Omicron. But it's very infectious. So it's extremely infectious. You cannot stop it. In the United Kingdom, it's more than 90% are now essentially already infected by Omicron. So everyone in hospitals, everyone who is dying right now, if they had been tested if they had the test, most likely this test would show 90% likelihood that it has Omicron. And these people would still die if they were, unfortunately, having diseases. So you would see that number of hospitalizations with Omicron, specifically with Omicron, and number of deaths with Omicron, of course, jump significantly. Now, what the people dying, what they are dying from, again, based on the fact that Omicron is much safer, much less mortal or lethal compared to Delta and the original Wuhan variant. Omicron is the safe, not the safest, I shouldn't say the safest, but it has much less mortality rate than previous variants. We know that. So based on that, we can assume that there are less deaths of Omicron now compared to the number of deaths of Delta or Wuhan original or Alpha variant, right? So based on that, we would understand that this increase in deaths is very unlikely because of Omicron being infected by Omicron. It's something else, and we don't know what. And here we're data scientists here. We do not make any conclusions. We can ask questions, and we do ask questions. We can make observations, and we do make observations here. But anyone can make these observations yourself, right? And please use the chat window right now here, or if you're watching this video offline, please ask questions directly on YouTube. We will make sure we will respond to all your questions here. Please don't forget to subscribe to this channel, and also please also subscribe us now on a Facebook page. We have just created last week. We have created a Facebook page which is shown right here. It's called Open Canada Data, and we now have 38 members in 1 week. And we also have Twitter. I have my personal Twitter here, which now has 135 followers. Just one joined us right now as we speak, which jumped from 60 last week, so twice as many. Again, we just try to talk about data, to help people to see the data better using contemporary techniques. Now, what I'd like you to show you, how you can visualize this data yourself. This is done with the Death Tracker app. And you would see here, we have a collection of applications built specifically to help you to visualize various data coming from official sources. Now, if you click on Death Tracker, you would get to this app, which is interactive and which reads data directly from Statistics Canada website, provisional weekly death count by causes, and it would allow you to play with it. It's almost like a game. It's interactive, and you can invite your children, your neighbors, and play with it. Now, you have to allow the program to load the data. It takes about 1 minute or half a minute, and you would see the error message. You just saw the error message. When it loads the data, when there is no data, it shows the error message. Just ignore it. You have to wait for about maybe 30 seconds, because again, it's getting the data directly from the source. And it shows you this graph. Now, this graph shows a little more than what I've shown you there, because here it shows you by causes. This app has been built about 4 months ago, and it allows you to track causes of death. How you do it, you can select here which causes of death do you want to plot. And let's say right now, I'll just select total causes and cancer, which is neoplasm. Okay, so you have one row, top row shows you for total causes, and the other one shows you for cancer. And we have added a new functionality here, which was not there last week. It's called Show Excess Deaths. And that's how you get this black line added on top of the other line. So let's see what happens when you click here. When you click here, when you don't have this functionality, it will just show you the changes of deaths over time. And it's very interesting information, because you can even see the dynamics, for example, for flu. For example, you can add also flu, and the way you do it, you just hold Control key and click on this to add. You can add also suicide, which is intentional self-harm. So you see, we now have 4 rows here. And then you could do some analysis of this. For example, you could show a trend line. You could just put a line and see whether it goes up or down. And here you would see, for example, that for the third line, which is in influenza, essentially, we have much less influenza cases during the pandemic, and people know that's the case. But also very interesting, we have less cases of suicide, right? And this, of course, becomes a very interesting observation, because in fact, during the pandemic, it was known that people were very much distressed, being laid off, being put on leave without pay, not allowed to travel, to attend social activities, sports activities, cultural activities, for example, if they're not vaccinated. So it would have been expected that accidents, I mean, suicide, not accidents, sorry, suicide would go up, but they go down. So this is indication that maybe some of those suicides, they were labeled as COVID cases because they were also maybe having COVID infection. And I just added COVID here. Now, when you click on Show Excess Deaths, it will just compare these curves to historical average. And now you can compare what you have now in 2022 or 2021 with a historical average shown by a red line. So that's pretty much it. Now you can also ask the application to show you the absolute difference. and it just subtracts the number. The black line would show you 0, meaning there is no change. If it's above black line, it means you have excess deaths. And this is where we would see that we have excess deaths in all provinces, maybe not as much in Quebec right now. Or you could also show it as a relative difference, as a percentage, by how much we have this. And this is where you see by how much it's by, for New Brunswick, for example, it really goes by more than 25% here, by 30% up. So it gives you numbers to quantify the excess deaths before vaccination and after vaccination. And these dash lines, vertical dash lines, show you the beginning of pandemic, the first dash line. Then the second dash line shows you the it's before the second wave, and this is also when the policies have changed in some provinces. Then the third dash line shows you the beginning of vaccination, and then the last dash line shows you the vaccination with the general population. So you can play with it, you can show it using different scales. For example, logarithmic scale can be used sometimes, it's very convenient. Shows you how much increase. You could also add, for example, vaccination rate. You can ask to show vaccination rates if you don't remember what it is, but most people already know it. You know how it was going up. It started from 0 in January 2021, and it reached 80 in about November, December. But then you can compare, and you could correlate these curves with the other curves here. So you can really have a good time exploring this app, and we will be adding more functionalities there soon. So that's pretty much what we wanted to say. Thank you everyone for watching, and again, please join us on this is the channel Independently Verified Information, on Facebook group Open Canada Data, on Twitter with and keep following us also on our main website ivim.ca. Next seminar will be held as always on Friday next week, and we would normally announce it right here on this web page /data/seminar, and we will also post slides, transcripts, and announcements right here. Thank you everyone for watching. Be safe and enjoy. Spring is coming.